In its 90th year of providing health care to Long Beach, Community Hospital Long Beach continues to grow the legacy it's had since opening its doors in 1924. 90 years ago, Fillmore Condit formed the Long Beach Community Hospital Association to raise $369,000 to build Community Hospital Long Beach. Community Hospital Long Beach opened its doors in 1924 with 100 beds and a staff of 175 surgeons and physicians. Over the next several decades, Community Hospital continued to expand to include the area's first tumor and cancer diagnostic clinic in 1937. In 1959, the 6-story East Wing was added, doubling the bed capacity to 300. In the decades to follow, the hospital added its intensive care unit and the Community Heart Center.
For decades, Community Hospital has served as a fixture and a critical healthcare access point for Greater Long Beach. And so it was really natural with our shared culture, our shared values, and a shared commitment, a legacy of not-for-profit healthcare in the Greater Long Beach area that we both endeavor to provide. It was natural that Community Hospital would become acquired by Memorial Care now more than 3 years ago. Our goal for Community Hospital, certainly upon acquisition, was one, to ensure continued access to health care for the east side of Long Beach. Community Hospital has a thriving emergency department that cares for more than 2,000 patients each month. Additionally, Community Hospital has acute care services, medical surgical services, and an intensive care unit. But what's also unique about Community Hospital is a growing and expanding mental health and wellness program. And this is something critical, not just for the east side of Long Beach, but for all of Long Beach, for now and well into the future. A secondary goal of acquiring Community Hospital was to preserve, at that time, nearly 600 jobs. And we very much view the future as preserving those jobs and, in fact, having even more opportunity for employment associated with Community Hospital now and well into our future.
When we first got here in April of 2011, we looked at our entire inventory of services that we were offering to our community. And after looking at the needs of our community, we realized that we can expand on mental health. So the first thing that we did was offer outpatient psychiatric services via the clinic that we opened, as well as the outpatient partial hospitalization intensive outpatient program. We also introduced an inpatient geriatric psychiatry program and a perinatal mood and anxiety disorder program, one of the only few in the country that's being offered. So with the outpatient and the inpatient expansion of mental health, we now have a full range of mental health services to the new mom as well as the older adult. In the previous years, Community Hospital Long Beach had run several of its programs under management agreements with third parties. We decided with the expertise that we have throughout Memorial Care and Long Beach Memorial that we can bring some of these services in-house, one of which was our rehabilitation services, namely physical therapy, occupational therapy, and speech therapy. We are one of the few certified hand therapy programs in our region. One thing that stands out and that we have grown over the number of years that we've been here is our cosmetic surgery program. Very well-known surgeons throughout the region and in Long Beach are very attracted to this program, as well as the patient following that they have. In addition to that, patients have the ease of use of the campus and the option of staying overnight to recover from their surgeries. We also have a very attractive general surgery program. Over the years, we have grown our medical staff from what it used to be around 200 to well over 300 today, and continues to grow. We have introduced specialties in ear, nose, and throat, in urology, and ophthalmology, as well as general surgery. Community Hospital has been in the community for 90 years. We look forward to being in the community for many more decades to come. We like to be part of the growth. We like to be part of the expansion of the existing services, as well as new services that have not been introduced yet. We'd also like to introduce adolescent psychiatry services. Our state, our county, there's a shortage of adolescent beds. On the medicine side, we'd like to introduce addiction medicine program for those that are suffering from either alcohol or prescription medication addiction.
Community Hospital, congratulations on 90 years of service to our community. And again, welcome to the Memorial Care family.